Your passcode has been confirmed. If you need technical assistance during your call, please press star followed by 0. After the tone, please state your name. Thank you. There are 23 parties in conference, including you. This conference is in silent mode.
Cell disease and improving treatment and education until cures can be found. Throughout his 20-year career in sickle cell disease, he has pursued translational research on the role of inflammation in pathophysiology, clinical research with multidisciplinary teams, and community involvement. Next, we have Dr. James Sande, who is Associate Professor of Pediatrics at the George Washington University and attending physician in pediatric blood and marrow transplantation at the Children's National Medical Center. As a transplant physician, she has a special interest in transplantation for sickle cell disease and is leading the development of a comprehensive sickle cell transplant program within the Division of Blood and Marrow Transplantation. Next, we have Dr. Amanda Thompson, who is the pediatric psychologist in the Center for Cancer and Blood Disorders at CNMC in Washington, where she provides clinical psychology services to patients and families in the Department of Hematology Oncology and Blood and Marrow Transplantation. Then we have Dr. Emily Meier, who is the new director of the Sickle Cell Program at Children's National Medical Center. She's a translational research at the National Institutes of Health, investigating genetic markers of disease severity in sickle cell. We also have Lisa Thaniel, who is a sickle cell social worker at the Children's National Medical Center. She is active in community outreach and conducts clinical research on adolescents' readiness for transition to adulthood. And then finally, we have Jackie Lagerlof, who is the physician assistant in the hematopoietic stem cell transplant program at Children's National Medical Center. She is deeply committed to building family awareness of the bone marrow transplantation options for sickle cell disease. So at this time, I'm going to ask that the speakers only, if they can unmute their phone by pressing *6, and then you can go ahead and begin addressing the audience. So thank you very much.
Hello, this is Louis Sue.
Yep, we can hear you. Thank you.
Great, thank you very much. Thanks for having us. Part of the reason for doing all this way is that it's really been a team effort, and another part is that the essence of this educational approach was to have a panel discussion and to have multiple disciplinaries involved. So that's why we're all here, and it's going to be a little bit cumbersome. We're going to be passing the phone or sliding seats, but bear with us. Next slide, please. So the goals and objectives of our project was to, of this webinar, basically, is to look at the methodology of our approach to educating families about transplant for sickle cell disease and to see how our intervention affected patients and families' knowledge of stem cell transplant. The unique part of this was that we tried to measure it. We got IRB approval, distributed survey, and you're going to hear the results of that. And then also through these, both the survey and also through our experience, we hope to identify areas for improvement for future family education conferences. Next slide. So as most people with sickle cell, in the sickle cell field know, transplant with hematopoietic stem cells is the cure for sickle cell disease. Right now it has been offered to many people, and there's been 200, 400 or more cured of sickle cell disease across the world, but there are many barriers to prevent its widespread application. Some of the principal barriers are who the donors are. Right now it's mostly been with sibling donors, and not everybody has an HLA-compatible sibling. And then also there's risks of adverse outcomes. There's risks of death, of graft versus host disease, infertility, organ damage, graft failure, graft rejection. And so there are many clinical studies that strive to address these barriers, but this project was not trying to do that per se. Next. Another large barrier really is the lack of information about transplant, that many families don't know about transplant or have a very partial view of it, or just don't quite know when to ask about things and who to ask. So one approach that we decided to take was to really have an education conference with panel discussions so that the families who had questions about sickle cell transplant could ask multiple experts at the same time, and could ask also families and patients who'd been through the transplant experience to get firsthand accounts and have lots of opportunity for question and answer. Next. So the basic idea is that here's the scenario. In many cases, you have a patient or a parent saying, tell me about bone marrow transplant as a cure for sickle cell. What are the pluses and what are the minuses? And on the one hand, I'm saying, sure, I'd be happy to do that. And on the other hand, I'm having an internal conversation. Where do I start? What's the best way to give this very complex message about unpredictable risks? Next. So the goals of this conference was to offer families who are interested in transplant for sickle cell about a half-day session with expert information from transplant experts, hematopoietic stem cell transplant physicians, and also firsthand experiences from families, children, parents, and also an adult who had transplant herself, who've been through transplant for sickle cell disease. And then using as much of a question-and-answer format and panel discussion format as possible to allow families to raise their own questions and also hear other questions that they may not have considered themselves. So we invited families who'd been through transplant for sickle cell who are living in the Washington, D.C. area. Most of them are from our own institution, but also the National Institutes of Health is very close by, and so some of those who had been through transplant at NIH were invited as well. To decrease barriers to attendance, we put in various features. We had the conference on a Saturday. There was no registration charge. There was free shuttle bus transportation from the Metro, which is our public transportation. We also offered free parking and a free lunch. We used our own hospital's auditorium and cafeteria in order to reduce costs rather than try to hold it at a conference center or someplace else. We advertised the conference in sickle cell clinics and had flyers and word of mouth. Chronic transfusion patients were targeted because they're some of the ones who most often meet the eligibility criteria for sickle cell bone marrow transplant. During a couple of community events, the Sickle Cell Disease Awareness Walkathon in the D.C. regional area, and then also at a National Sickle Cell Disease Association of America conference that happened to be held in Washington, D.C., we had booths that promoted the conference. And then the other part of our methods was, as I mentioned before, trying to have some quantitative feedback using surveys. And we did obtain IRB approval to conduct this portion of the study. So we had anonymous surveys that were distributed pre- and post-conference to the families and patients who attended. And then this rather busy slide here is a snapshot of what our agenda was, just to give people an idea of the practical aspects of things, so that the time frame is shown in the far left column, running from about 10 o'clock in the morning until 3 o'clock in the afternoon with lunch in between. And we packed things in so that we had talks in the morning, terminology and key concepts, and then latest information about sickle cell from 3 different experts with opportunities for question and answer after each one. And then, whoops, sorry, go back. And then we had lunch time with more panel discussion, really just as anybody could pick a lunch table to sit with somebody and ask them questions. And so that was going for about half an hour. And then after lunch, we had more panel discussions with patient discussions about why did you choose to go to transplant, what kinds of things were you looking for, how did you think about it. And then after the closing of the formal session, we had some additional time for one-to-one discussion, which people really used for about an hour or so. And so the total time for question and answer amounted to roughly 2 hours, sometimes maybe 3. And I'm going to hand over to Dr. Sande.
So I want to go over our results, and this refers to the people that we were managing to involve in our conference, as well as some of the results of the survey that was distributed. We were really pleased with our attendance. We had 110 family members and people with sickle cell disease registered, which represents about 10% of our center's active patients. We did get a few patients from nearby hospitals, but the vast majority of participants were from our own program. 14 attendees were from 6 families who had been through transplant, including 1 adult from NIH. The vast majority of the transplanted patients had good outcomes, but we were also very fortunate there to have the mother of a child who had died 9 months after her transplant, not from complications of transplant, but we felt very strongly that we needed to present the negative side as well. All of the people involved would be volunteer panelists again. We're happy to participate. And there are also 4 attendees from the Sickle Cell Association of the DC area community group. We had 4 transplant physicians presented on a volunteer basis. All 4 of them are principal investigators of multi-institutional or nationwide studies. So the family had access to the latest information on the latest research. 3 staff members acted as moderators. This included social workers and psychologists, so very multidisciplinary group. We had volunteers, event planners, ushers to help move the conference through. Obviously, we had public relations and marketing people involved and technicians. And then staff members, including nurses and social workers and other physicians who weren't presenting, attended the conference as well. The questions from the conference attendees were really extremely variable and conveyed their concerns, but also the level of sophistication of their knowledge about transplant. So they ranged from superficially simple questions, but really very complicated questions about how did you make this decision, how did you decide you wanted to proceed, to really kind of technical detailed questions as to whether the number of blood transfusions affect the transplant risk. So these 2 questions kind of reflect the range of knowledge with which these families came to this conference. The attendees in general reported very high satisfaction with the conference and were very, very positive and wanted to see more sessions in the future. And as Dr. Su mentioned, the question and answer sessions extended well beyond the conference time because the families really had very urgent, very important, very well thought out questions, and so they would wait in line to talk to the presenters about their questions, and so that was very, very positive. Remarks by the family panelists, which they stated, sitting in front of the whole audience. One of our patients, less than a year post-transplant, said she's playing field hockey now, and she couldn't run a mile, a year before her transplant. Another patient talked about the isolation that's imposed on our transplant patients because of the risk of infection and how hard that was. There are a lot of concerns from the community about infertility as a result of transplant and the chemotherapy exposure. Now, that was probably the major concern for most of our families. And at least 2 family panelists said, if he or she does not live, I am not going to have grandchildren. So I would much rather have my child and take the risk of not being able to have children. The overall overarching theme was summed up by one of our parents who said, you have to ask questions, be sure whatever happens that you have no regrets. And Dr. Thompson will talk now about the survey.
So as has been mentioned a couple of times as part of the symposium and as a means to have some evaluation of the day's effectiveness at disseminating the information, we created brief pre- and post-symposium surveys, the goals of which were to explore participant familiarity with and attitudes towards transplant for sickle cell disease, to evaluate concern for risk of transplant both before and after the symposium, and to assess the perceived knowledge gained. Next slide. The surveys included some true-false questions and some Likert-type rating scales, and it was developed with input from the sickle cell and bone marrow transplantation groups here at Children's, and as has been mentioned, approved by our institutional review board. It was distributed at registration to all families attending the symposium. Both verbal announcements and printed information indicated that the surveys were anonymous and optional. Participants were asked to complete the pre-survey prior to the start of the morning lecture and the post-survey at the end of the programming. Next slide. In terms of participation, we had about 75% of our family participants complete the pre-survey and about 63% complete the post-survey. Looking at those who completed the pre-survey, we were able to get a sense for what kind of information families already came into the symposium with, or information they may have been lacking. Almost a full quarter of the participants had actually never heard about transplant from physicians prior to the symposium. We had about 44% reporting that they had, in some way, shape, or form, already discussed transplant with the team. 35% indicated that they had read about bone marrow cord blood transplantation before the symposium, and almost a full 65% indicated that they did not know whether they had an HLA-matched donor in the family. Next slide. On both surveys, we asked the participants how concerned they were about risk for transplant on a scale from 1 to 5, with 1 being not at all concerned and 5 being very concerned. And we went and compared pre to post, we found that the average concern for risk decreased over the course of the symposium from about a 4.4 on that scale to just under 4. So in terms of absolute numbers, not a huge change, but one that in fact was statistically significant. Next slide. Looking at that risk question in a different way, we also found that about 7% of participants indicated more concern about the risk for transplant after the symposium. 63% reported no change in their perceived risk, and 30% reported a decrease in risk. After the symposium, a full 87% of participants expressed a desire to speak further about transplant with the transplant team, and reports of the amount learned about transplant fell right about 4.5 on a scale where 5 meant I learned a lot. So from this survey, what we're able to say is that we felt like our half-day symposium and the format that we presented really appeared to be quite successful in educating families about sickle cell transplant. Furthermore, the survey results indicated that after attending the symposium, a majority of families wanted to explore a transplant with the medical team, despite the fact that there were still ongoing concern about risks. In other words, families really got the message that the risks of transplant were real and were not to be taken lightly, but they were also interested in learning more about transplant as an option for a cure for their children's disease. Switch over to Dr. Meier now.
So I'm going to talk a little bit about the expenses for the conference. So you can see from this slide that about a quarter of our costs came from advertising for the conference through either flyers and posters, and then also for some fees at the walk that Dr. Sue mentioned earlier, and then the SCDAA conference table. We also spent about a quarter of our budget on a shuttle bus that was only used by 2 people, and we'll get into that in the next couple slides about things that we would change about the conference. And then about a third of the budget was spent on the free lunch, on the lunch and beverages that we did obtain from hospital catering. Unfortunately, despite numerous attempts, we were not able to obtain any external funding for the conference last year, so we were lucky enough to meet an event planner who donated her services and helped us a lot with conference planning. Next slide, please. So some of the things that we learned, we needed to start earlier in the planning process. I think last year we were only able to advertise for the symposium for about a month in advance, but despite that, you can see that we still had excellent attendance at this conference. We also needed to do a better job of disseminating the information to staff within our center, and then also we wanted to reach out to other centers outside of the immediate Washington, D.C. area, but closer in Virginia, in the state of Virginia, and also in Maryland. We would not provide the shuttle bus service, again, just because of the cost and the fact that not very many people used it, since we were offering free parking. We queried our parent advisory board that we have here at Children's for patients with sickle cell disease, and one of the things we heard from them was they wanted less time spent on the lectures that started the conference and more time for interaction, one-on-one interactions with the presenters, and more time for questions. And then also they requested some way of archiving the panel discussion, so either video recording or in a format like this that they could go back and re-listen to or re-watch the question and answer part of the panel discussion. So in conclusion, the families explored transplant in this educational conference, and the average perception of transplant for sickle cell disease risk was decreased. but we feel we did present we did a good job of presenting a well-balanced look at transplant because some families did report increased perception of risk. And we found that a panel discussion conference format benefits the families and the medical team with insights on the major concerns of families who are thinking about transplant as a curative option for sickle cell disease. This conference format also provides a unique opportunity to obtain information beyond standard counseling sessions with hematologists or transplant physicians, largely in part, I think, because of the ability to hear questions from other families who are also in the same situation. And then the panel discussion of firsthand experiences can be a powerful format for examining the risks and benefits of a major treatment decision like hematopoietic stem cell transplants. Now I'm going to turn it over to Jackie Lagerlof.
So this is just going over the references from this presentation, but you can go on to the next slide. And this is other centers that have participated in unrelated donor protocols. I'm not going to list all of them, but it goes through many of them. As well as this talks about banking for cord blood. So this gives information for sibling connection as well as related donor cord blood program that's out there for families who would like to save the cord for other siblings that are not affected with sickle cell disease. Next slide. So a great important thing here is we're having another conference, which will be held on Saturday, October 22nd. It'll be held from 9 a.m. to 3 p.m. Here at Children's National Medical Center. So anyone who is on the line that is nearby, we would love you guys to come and participate at the conference. We'll have a guest speaker, Shalini Shenoy, who's going to give a session. She is a leading physician out in the community, in the country on sickle cell disease for transplant, and has a multidisciplinary trial that's with sickle cell disease and transplant. So if you have any questions or wish for further discussion about the conference, you can contact Dr. Meier. She's listed here. Next slide. I think that's it.
Wonderful. Thank you so very, very much. So we're going to now open the line for questions. And if anyone has a question, you can remember to go up to the Q&A tab on the top of your screen and click in the hand over in the right-hand corner, and that's how we'll know that you have a question. Or if you want to, you can just unmute your phone by pressing *6 and state your name and where you're from and what your question is. So the lines are now open if anybody has anything that they'd like to ask. Remember, it's *6. I can see there's a lot of people on the phone, so we welcome your questions.
While we're waiting, I'll just mention that this indeed was a big team effort, and we're quite pleased with the level of participation by both staff and patients. And then there were a number of comments from different staff, hospital nurses, various people on the sickle cell team, that they learned a lot from attending this conference and from hearing what kinds of questions the patient panelists had, or what kind of answers they had, and also what kinds of questions were being raised by families. So in some sense, this is major two-way education.
Can I ask a question? It looks like we have a question from Danielle. Danielle, if you'd like to press *6, and you can ask your question. Are you there, Danielle?
Hello.
Hello? Yeah.
Oh, sorry.
Okay.
Yeah, hi, this is Danielle from Michigan. You mentioned a large majority of the participants mentioned being interested in speaking with a transplant team after the conference. Do you know how many of them actually followed up and pursued exploring that option?
This is Dr. Sande, and as the leader of the sickle cell transplant initiative in our institution, I am seeing most of these patients now. And I would estimate that I've seen at least a dozen families that were involved in this conference, and I continue to see families that have heard about the conference and have interest, both at our downtown center but also in our Northern Virginia practice. As I've said, we've been really promoting the October 22nd conference, and we're getting a lot of interest in that beforehand, even before we've really started to advertise. So it really has heightened the awareness. It's resulted in increased self-referrals from families who were there, absolutely.
Okay, great. Thank you.
Okay, I think, is there a Jane Hankins? It looks like you have a question.
Yes, I do. This is Jane Hankins from St. Jude, Memphis, Tennessee. Did you share information of both matched SIB and unrelated transplant at this conference? And
yes. I'm sorry. Go ahead.
And then the question is, are you going to now prospectively follow how many patients actually will go through transplant and try to correlate with the perceived risks and benefits during their conference?
Absolutely, yes. So we had a good mix. We had the adult who was transplanted at NIH had a matched sibling donor. We had another family of African origin who had a matched sibling, combined cord and marrow, because we didn't have a lot of confidence in cords at that time. The other 3 participants had 10 out of 10 matched unrelated donors. I think it's important to note that all of these individuals were transplanted on reduced intensity conditioning protocols, including the young lady who died 9 months after her transplant, whose mother was there representing her. So the vast majority were on the alemtuzumab melphalan fludarabine trial, either the SKIRT trial that's co-PI'd by Nainish Kamani and Shalini Shenoy, or Shalini's multi-institutional study that has the same preparative regimen, but a little looser eligibility criteria. So yeah, there was good representation. We had a young man who was transplanted with a cord blood who rejected his cord, and we tried to get him there, but unfortunately he was in our intensive care unit with a vaso-occlusive crisis and some respiratory problems at the time, so was unable to attend. This year we have a young lady who got a 9 out of 10 MUD on the same study who has horrible graft-versus-host disease, and she will be presenting as well. So we're trying very, very hard to present a balanced perspective. Regarding your second question, yes, we are prospectively tracking. Jackie Lagerlof, who wrapped up the conversation, has developed a really great system for tracking patients who are referred to us from a hematology group, and we're keeping very close track of these patients. We have kind of a prioritization system for obtaining HLA typing and doing consultations. So if it's just a family that has matched SIBs and are curious about transplant, we'll go ahead and write letters for authorization, get HLA typing, but that doesn't necessarily result in a consult with the transplant physician. Other families that might meet criteria for an unrelated donor transplant will actually have a consultation with us and start talking really seriously about transplant. So yes, we're prospectively tracking all that.
And can I ask one last question? Thanks for
your
answers. So did hydroxyurea come up in this meeting? Because a lot of the things that come up in discussions of treatment options is that, and the mental notes that the families make when we present a treatment option, and they, in their minds, they start comparing risk benefits among different treatment options. So was that brought up by the families at all when they're trying to, in their minds, compare what's best for my child?
You know, it wasn't really brought up by the families. It was mentioned as part of the background information, the 20-minute opening talk that gave defined terms and talked about, general treatment. But that's a very good question, and I think now with the Twitch trial, I think we probably need to put that front and center, because it will, for families with abnormal transcranial Doppler studies, they will have an option of either transplant or Twitch. So I think that's a great question and something we need to think about.
Thank you.
Wonderful. Are there any more questions that anybody would like to come on the line and say? And if you do, just remember you need to push *6. Okay, going once, going twice.
Just to follow up, this is Dr. Sue. Just to follow up on the hydroxyurea part, for those who've had central nervous system problems, basically the sickle cell patients are on transfusions. But for those who've had pain or acute chest as their indication, our usual hematology practice has been to give them a good effort of trial with hydroxyurea before, sort of in the process of thinking about transplant, but definitely that they want to have some kind of trial of hydroxyurea before they go to transplant.
Wonderful. Okay, well, if there are no more questions, is there anything else that our panelists would like to share with the listeners today?
If anybody else wants to have a...
Thank you. This has been fascinating, and the presentation was wonderful. It was very easy to follow, so thank you guys very, very much. And we wish you good luck on your October conference. That sounds exciting.
Thank
you. I just wanted to let everybody know our next webinar is going to take place on Thursday, September 22nd, and it's about the New York Blood Center's Precise Match program. This is something that was presented to the CDC group here a couple of months ago, and it was really fascinating. So I encourage everyone to log on and listen in if you have the chance. And if you have any questions, feel free to contact Shay Pope. She's the one who sends out the announcements, and her email address is spope@cdc.gov. And just as a reminder, the recorded webinars are available for viewing and listening at www.scinfo.org under the webinars toolbar. And today's presentation, it'll probably be a couple weeks, but then it'll be up there and ready to log in and listen and watch. So thank you guys very much for participating, and hope you have a great rest of the day and a good week. Bye-bye.
Thank you.
Bye. Thank you.